Yeah, so what is deep brain stimulation? So it's very simple we've all seen a cardiac pacemaker. We have seen that there is an electrode that goes into the heart, and then there's a pacemaker or a battery that is placed in the anterior chest wall. So deep brain stimulation is very similar, only the only thing is the electrode is placed inside the brain with sub-millimeter accuracy inside the brain. So it's basically in one of the nucleus of the brain. And these control the movements. So if you ask me how does it work? Well, even after so many years and so many thousands of DBS that happen all over the world, we're still not very sure what the exact mechanism is, but it definitely works. And what are the uses of deep brain stimulation? We use it for Parkinson's disease, dystonias, essential tremors. It's also used in psychiatric problems like severe OCDs and epilepsy, and also for severe depression. Now, so how do you select a patient with Parkinsonism for deep brain stimulation surgery? It is a multi-team approach. It doesn't work with, as a single person, I will do everything. No, it does not. It requires a neurologist who is going to evaluate the patient, and then it requires a neurosurgeon who is going to be doing the surgery. But not just these two, it requires physiotherapist who's going to be evaluating the gait, evaluating how the patient is, progressing. It also requires a psychologist, a psychiatrist, and a nurse specialist. These are all a part of the team. Without even one person, it just does not work. So, as I was telling you, it is these are the batteries. So there are two types of batteries. One is the rechargeable and the non-rechargeable. And this is how the electrodes go into the brain. And in the subcutaneous plane, the battery goes, the wire connectors go to the subcutaneous plane, and it's in the anterior chest wall. So who has the best results or who are the ideal candidates to undergo a deep brain stimulation surgery? So anybody with idiopathic Parkinson's disease, generally they have the best results, not a secondary Parkinson's disease, and minimum of 4 years of disease. Because a lot of these conditions mimic Parkinson's in the initial years, like multisystem atrophy, progressive supranuclear palsy. They all mimic Parkinson's in the initial years. So they will show their true colors only by 4 years. So we don't want to advise surgery straight off the bat for somebody diagnosed with Parkinson's. We generally wait for 4 years. They should have a good response to levodopa. Only those people who have a good response to levodopa will be the people who will have a good response to DBS also. Younger age, my upper limit, world over they generally don't do beyond 75. My upper limit is 70, but younger age, they do well. They should not have major cognitive impairment or major psychiatric problems. I have seen patients, I have one of my own patient committed suicide following deep brain stimulation. It's a known complication, especially when somebody has a cognitive impairment, or especially have somebody who has a psychiatric problem pre-existing. They tend to do worse. So what are the symptoms that do well with surgery? So rigidity, tremors, bradykinesia, dyskinesias, motor fluctuations, they do very well. But some of the things that don't respond to deep brain stimulation are the sleep disorders, people who have cognition impairment, those who have gait instabilities, and those who have autonomic disturbances. They don't do well with deep brain stimulation surgeries. So quick videos of how these respond. So this was a lady from Bangladesh. So she had, can you see the rest tremor in the lower limbs? And so she has bradykinesia. When you ask her to do the finger tapping movements, you can see that there's so much of slowness in her movements, the finger clasping the movements, the hand rotation movements. And when you give her the drug, these patients develop what is called as drug-induced dyskinesia. They have these dancing movements once the drug is given. And you can see her gait next, and they also have very slow gait. So you can see that her gait is very slow, short stepping gait. And this is about a week after surgery. So you can see that her tremors are much better, her hand movements are much better, and you can see her gait is much faster. This is another example. He is a gentleman who had a DBS surgery. So this is like we can switch off the IPG or the battery and switch on the battery. So this is 1 week post-surgery, but this is where the battery is switched off. Can you see the tremors? You compare it with the tremors on the left side and the right side. Okay, he continues to have tremors. Now this is the right side video is where the battery is switched on. So the right side is on, left side is off. You can see that the slowness of movements on the left side, and see that how fast the movements are on the right side. Okay, so this is the difference. You're not going to make them 100% better, but you're definitely going to make them at least 50 to 60% better than what they were pre-op. So this is, can I go to the next slide, please? Can you go to the next slide? Start, yeah. So, so till it gets switched on, let me talk about the things that I've not put on the screen, that is the cost. So what does it cost? So the cost of the surgery, there are two types of batteries. One is the rechargeable batteries, the other is the non-rechargeable batteries. So the non-rechargeable batteries stay for about 4 to 5 years depending on the consumption of the current. So that needs to be changed every 4 to 5 years. The rechargeable ones stay for 15 to 20 years. And the cost is about 3 to 4 lakhs. So the rechargeable ones, yeah. So this is another gentleman. He was a lawyer. So this is his, pre-op. Then the right side is his post-op. So you can see his drug-induced dyskinesia. You can see how much more better he is. So I was talking about the cost. The cost is about 18 lakhs, 16 to 18 lakhs, depending on the center, for the rechargeable one, and the non-rechargeable ones are about 12 to 13 lakhs. So this is the same gentleman where you can see that his arm swing is absent and how he freezes when he tries to turn around. So okay, so when you see that this is 1 year post-op, his arm swing is so much better, and he doesn't freeze the way he was freezing post-op. Okay, so this is a child who came from Bahrain. This child had what is called as a pecan mutation with a brain iron accumulation inside the basal ganglia. So this child had very severe dystonia. You can see that the child is always having these dystonic movements. It was very painful. The child would not eat. It would always continue to have these, very weird movements. And you can see this is post-op. You can see the scar on the scalp, on the forehead, and the child is absolutely quiet. Initially, they didn't have money to go in for a rechargeable one. They got a non-rechargeable one, and then 3 months later, seeing the response, they came back, got some money, came back, and changed it to a rechargeable one. Of course, this is a progressive disease, but still, the child did well. Now, a little bit about spasticity surgery. So, spasticity surgery, we all see a lot of children with spasticity. We all see a lot of adults with spasticity, especially post-traumatic. So, you have the ablative procedures and you have the non-ablative procedures. The non-ablative are usually the intrathecal baclofen and the spinal cord stimulation. The ablative surgeries are the rhizotomies and the neurectomies. So what are the criteria for baclofen pump? So baclofen pump, they should have a good response to test dose, usually between 18 to 65, severe chronic spasticity and refractory to medications. So what we do is we put a pump inside, usually in the anterior abdominal wall, and the distal end of the catheter tip goes into the intrathecal space, and then it continuously releases baclofen. So you avoid the systemic side effects, and baclofen is acting directly centrally, which causes a lot of relief to their spasticity. So this is another procedure called the rhizotomy, where you cut off the afferent arc, so that the dorsal roots, very fine selection of the dorsal roots. And this is also used predominantly in children with spasticities, especially cerebral palsy children. So the age is usually beyond usually age criteria is 2 to 8 years. They should have mild to moderate leg weakness. Usually the lower limb involvement more than upper limb are the ones they do very well. But most importantly, what my take on the cerebral palsy is, it is a continuum of the treatment process. Usually starts with a selective dorsal rhizotomy as the initial procedure. Then the most important is that they should be motivated, the parents should be motivated to have continuous physiotherapy, because you do everything and then you stop physiotherapy, they're again going to have spasticity, they're going to be back to square one. Nothing is going to work. And then you have these orthopedic procedures like release of the tendons, and final is the orthotics. So this is a continuum of treatment for children with spasticity, and they do very well. Finally, a brief about spinal cord stimulation. This is my purchase manager who's working in my hospital. He had a very severe, he had a brachial plexus injury, which was about 20 years ago. He had a motor vehicle accident, and he had such severe pain that he was refractory to all pain medications. The only thing that was giving him some relief was one bottle of alcohol every night. So he was drinking every single day. And after a lot of deliberations, he finally decided to go ahead with the surgery. So we did a spinal cord stimulation for him. So this is where you can see on the right side bottom is where the IPG is. So we approach through the dorsal and then thread it extradurally all along to the cervical area. So you can see that the electrodes are placed in the cervical spine. Okay, this is extradural, and this is how it is threaded all the way there. So, and then once he switched on the IPG, he had tremendous relief of his pain, and not that he stopped drinking, but he doesn't drink one bottle, maybe just a couple of pegs. All right, that was all about it. Thank you so much.